The blame game over the rise of COVID-19 cases and deaths in Texas. Democrats have pointed to Republican Governor Greg Abbott's policies restricting public health mandates, including masking in schools. The Republican lieutenant governor on Fox News falsely seemed to claim African Americans are driving the surge.
The COVID is spreading, particularly most of the numbers are with the unvaccinated, and the Democrats like to blame Republicans on that. Well, the biggest group in most states are African Americans who have not been vaccinated. The last time I checked, over 90% of them vote for Democrats in their major cities and major counties. So it's up to the Democrats to get, just as it's up to Republicans, to try to get as many people vaccinated.
So, putting aside the fact that state leaders are expected to lead all of their people in their state, not just their political parties' voters, statistics from the Texas Department of Health, State Health Services, show that African Americans make up a sliver of the state's COVID cases, 16.4%, and just 10.2% of fatalities. I'd also note they're just 13% of the population, according to census data. But let's get to the public health issue. Joining us now to help us separate fact from fiction there, Dr. David Winter from Baylor Medical Center in Dallas, and Leah Wright-Rigueur, ABC News contributor and Brandeis University professor. Dr. Winter, well, let's start with you. So what are you seeing in the field? Set the politics aside at Baylor Hospital, and how is the hospital faring during this surge?
Well, new cases of COVID are climbing every day. Hospitals are filling up. Many hospitals now are on diversion. They're canceling their elective surgical cases. It's a major crisis right now. And in fact, of the people in the hospital, all the expanded hospital beds are being used up by folks, and the vast majority are unvaccinated. So that's the issue. Vaccinated folks seem to be doing fine. I've got a lot of those in my own practice. They'll have a 3 or 4 day mild illness, and we quarantine them, and they go back to work in 14 days. That's not a big problem. It's the unvaccinated folks that are driving this hospitalization crisis right now. We're actually running out of beds.
And Leah Wright-Rigueur, so the NAACP president fired back at Lieutenant Governor Patrick, saying that, quote, his statement is not only baseless, it's racist. Falsely casting blame on the black community is one of the oldest tricks in the book. So, to me, it's really less about race. The profile of the unvaccinated of all of us, they tend to have lower access to education and health care. They tend to be in marginalized or neglected communities. They have, just generally less income and less resources in this society, whether they're white, black, or whatever. So what's going on here, do you think?
So I think for the first part, the lieutenant governor is just wrong, right? So in an effort to kind of distance himself or refuse to take accountability for the role of leadership in this disaster and in, I think, extending the pandemic and not doing the right thing, particularly in calling on constituents across all racial groups to get vaccinated and doing what is necessary to make that happen. Instead of doing that, he simply blamed the racial group for the problems. And the number one problem with that is that it's not true. It's not accurate. But on top of that, I think one of the things that we see is that it's needlessly politicizing and racializing something that is, in fact, much bigger than all of that. One of the things that we have to overcome, and one of the things that people, including, my guest co-panelists, have been fighting against, really, is the unnecessary politicization of the pandemic. Right? If you want to get people vaccinated, casting blame on an entire racial group of people is not the way to do it. Playing this for political points is not the way to do it. Instead, stepping up and taking accountability in order to rehabilitate those relationships with these communities and have organic relationships within the communities that encourage vaccination rates is what we should be doing. But instead, right now, what we're seeing is political games.
And Leah, that's a great point. And I want to take back to Dr. David Winter. They're on the front lines in this really public health crisis for Texas. When you hear all of that, the way that the lieutenant governor has characterized the real problem here, you're treating people, I know, regardless of who they are. They're sick. They come to you for help. How do you deal with the noise around all of it?
Well, we just try to get our message out that it's very important to understand this virus right now is extremely contagious, much different than the other viruses. This Delta variant right now is the one that's so contagious, we're told you can walk by somebody without a mask and you can get sick like that. So we need to understand that we need to take special precautions. Vaccines is the best thing. Wearing masks, distancing, avoiding crowds. We need to get back to that right now. I can tell you our healthcare workers, our physicians, our nurses, all the healthcare workers, they're exhausted. We've been doing this now for 20 months right now. When I walk through the hospitals, some of them just frankly burned out. And then to add to that, you've got these young people that are desperately ill trying to survive in their 30s and 40s because they didn't get a vaccine or didn't distance themselves or stay home or whatever they didn't do right now. It's just heartbreaking to deal in this environment right now, Terry.
Certainly is. Dr. David Winter and Leah Reitberger, thank you both on these continuing tough days in the pandemic.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.